Hey everyone, it's Megan. This is my discussion board post 1. According to the CDC, antibiotic stewardship is making sure that patients get the right antibiotics at the right time for the right duration. An interesting statistic put out by the CDC states that 20 to 50% of all antibiotics prescribed in the U.S. acute care hospitals are either unnecessary or inappropriate. And an important part of being an advocate for our patients and about being a nurse is making sure that we're utilizing best practice. With critical stewardship, the nurse must ensure all orders have a dose, duration, and indication. We need to make sure that we're getting cultures before we're starting antibiotics, and we need to take a antibiotic timeout after 48 to 72 hours to assess the efficacy and the necessity of the antibiotic. Antibiotic stewardship programs have been shown to optimize the treatment of infections and reduce adverse events associated with antibiotic use. It also improves the quality of patient care, patient safety, improve cure rates, reduce treatment failures. There's also significantly cost association and decrease the cost of antibiotic use and antibiotic resistance. It says, moreover, these programs often achieve the benefits while saving the hospital money in recognition of the urgent need to improve antibiotic use in hospitals and benefit of antibiotic stewardship programs. An example of antibiotic stewardship in my clinical practice is once a patient spikes a temperature to 38.3 degrees Celsius, we always pan culture our patients. We get blood culture, sputum cultures, urine, and CSF cultures if they have a external ventricular drain. And once the results come back, they're started on the organism-specific antibiotic. According to Dr. Anthony Fauci, we understand that the best way to prevent the spread of Ebola infection is through the public health measures, including good infection control practices, isolation, contact tracing, quarantine, and provision of PPE. Of course, a vaccine would be the ultimate in prevention effort, but it'll still be a while before that can be introduced into patients. In relation to management of patients diagnosed with Ebola virus and the development of new drugs to treat Ebola virus, antibiotic stewardship can be seen in the way that the author Grounder discusses a moral obligation to study the effects of these new medications in human trials before we inject them into patients with Ebola. And that is my discussion post. Thanks.